So what was your closing thought? What was your closing comment there, Todd? Just before you dropped off, do you recall?
Um, so it had to do with, the coronary calcium score.
Yeah.
I find that to be helpful to risk stratify patients. So
Yep.
patient may come in and they may have elevated cholesterol or even borderline elevated lipids, and you're trying to make the decision: do I or do I not want to treat with a statin? And in general, primary prevention with a statin is really not helpful. You have to treat 500 people to prevent one heart attack. So
Okay.
499 out of 500 people don't benefit by taking a statin. Secondary heart prevention is different. So a person's already had a heart attack. Those patients have been shown to be benefited by taking a statin. So I'll use the coronary calcium score to more or less help the risk stratify to see, okay, is there a lot of plaque buildup in the patient? Because that can sort of push you in the direction of, being more aggressive with your therapies, whether that they're medical or in supplement form.
Yeah. What about a statin as being a powerful anti-inflammatory drug?
Yeah, I mean, the statins have been shown to have actually what's termed pleiotropic effects. So they may have other ways in which they're actually helping
Yeah.
prevent heart disease. Because again, heart disease is not about cholesterol; it's really about inflammation.
Yep.
So there may be other ways of doing that. But again, it's a double-edged sword. I mean, you speak to some cardiologists and they think they should just put statins in the water. But I've seen a number of patients who've had uh, you know, uh, development of insulin resistance with statins over a time period, memory problems, muscle aches, muscle pains.
Yeah.
So they're not benign. In some people they tolerate them pretty well, but other people they can have a sort of an insidious side effect profile. So you got to be very judicious in the use of them.
Yep. Hypertension, Todd, what we're doing in hypertension is we're trying to have patients use a blood pressure cuff and take their own blood pressure at home and then take an average, take 2 or 3 readings a day for a few days and then send that to their physician. Is that a good strategy?
Yeah, you can. I mean, before you treat high blood pressure, you really want to see what is going on an average level. So doing home blood pressure monitoring or doing a blood pressure cuff where you sort of like a Holter monitor where you can get an average blood pressure under different conditions. That can help you to really guide. Are you more dealing with sort of white coat hypertension, which is really quite common, versus someone who's got high blood pressure. And even if I find high blood pressure, I tell patients, unless you're having a hypertensive crisis, there's a lot of other things that you can do to treat high blood pressure. Namely, actually, believe it or not, going out in the sun. Going out in the sun will actually help the body to produce nitric oxide via the skin.
Mm-hmm.
So you can actually lower blood pressure through just a simple sun exposure. Deep breathing exercises. There's an FDA-approved device called Respirate,
Mm-hmm.
which stimulates the vagus nerve, and it can help to lower blood pressure. And that's there's really no side effects with that. So hypertension is one of those silent killer conditions, very, very common in patients. But I don't necessarily reach right away for medications just to treat it.
Okay. And then the 11, 12, and 13, these are our areas of obesity, early prediabetes, insulin resistance, and then diabetes. And this is a big can of worms, but what we're doing and what we're trying to get people to do is be aware that these entities exist and be aware that insulin resistance is probably one of the primary root causes of cardiovascular disease. And so this is multifactorial, and we're also asking people to take some of their own blood sugar measurements when you're healthy. Don't get a glucometer when you have diabetes, but just get a glucometer and start looking at your blood sugar. And we're trying to look at it, fasting 1 hour after they eat and 2 hours after they eat. We're trying to guide patients that way. And then the diabetic patient, that's really hard. So what are your kind of thoughts around this area?
Yeah, this is very much low hanging fruit. So 1 out of 3 people who walk through the door of a dental office or a medical office is going to have metabolic syndrome. It's almost so common that physicians overlook it because otherwise if they were focusing on it, they would be busy and be in the office till 11 o'clock, 12 o'clock at night. But be that as it may, with metabolic syndrome being the precursor to diabetes, it behooves us to diagnose it early. And the big ways that you can really easily diagnose this is looking at a lipid profile, looking for elevated triglycerides, anything over 100, looking for smaller LDL particle size, and then also looking for lower HDL levels. The one thing about metabolic syndrome is oftentimes this is when patients' blood sugars may still actually be normal, but they're having spikes of insulin to control their blood sugars.
Yes.
And you can be really, unless you're actually measuring simultaneously glucose and insulin levels, you can oftentimes be fooled and lulled into thinking that everything is actually okay. But what you're seeing there is, in order to control blood sugar spikes, the body's having to produce lots of insulin, and high levels of insulin contribute to both fat deposition and also systemic inflammation. So I like the oral glucose tolerance test, which I call it the stress test for the pancreas. That's a gold standard for me for diagnosing, the risk level of developing diabetes and at what level they have insulin resistance.
Yeah, when you do a 2 hour, and you're talking about a 2 hour, I would imagine.
Yeah, 2 hour. Yep, 2 hour. Yeah.
And when you get that lab back, they're measuring insulin as well?
Insulin simultaneously. Yeah. So and there's different ways of doing it. The way that I like it, and from what I've seen clinically and also read in the literature, is usually the glucose and insulin levels will usually peak at around 30 minutes. So if you measure it fasting, glucose and insulin, measure it at 30 minutes, glucose and insulin, and then measure it out at 2 hours, you'll get a good feel for what's going on. And you'll see how high their glucose goes up, how high their insulin is to control that glucose, and how quickly it comes back down to normal. So those are excellent tests.
Right. As far as yeast management and gut health, this is a major area of your expertise, but gut health especially. But what we see, what we're asking our dental patients is if they have chronic sinusitis, if they have frequent vaginal yeast infections, some people have rectal itching, if they have food sensitivities or sensitivity to smell, it could be a yeast, maybe a yeast issue. And we have now Oral DNA has a yeast test, a swish and spit yeast test, and they speciate the yeast, and I think they're looking at 7 to 9 different species of yeast. And we're seeing positive yeast tests in patients that don't have thrush and they don't have a typical yeast an overgrowth presentation like we got in dental school. And so what would your comments be about yeast in this area?
Well, we in our microbiome, we have hundreds of different varieties of bacteria, and we also live in symbiosis with yeast. And I like to tell my patients, these are a little bit like weeds in a garden. You're going to find small amounts of candida in the gut is normal. It's only under certain circumstances when they overgrow and they change from the spore form to the hyphal form and start being more pathogenic, is really when you need to be more concerned of them. Also, definitely if somebody has uncontrolled blood sugars, they're at much higher risk for yeast overgrowth. So you want to think about that. High levels of estrogen can also be a predisposing factor, and then sometimes immune dysfunction can cause yeast to overgrow. So that's definitely a real clinical issue, and you have to sort of be on the lookout for it. I actually have not checked oral yeast. The oral DNA test that I'm using currently, I don't believe that they test for it. Maybe
no, you have to order that separately. You can use the same saliva sample though. So, however, if you suspect somebody, I built this idea on a paper that looked at 96% of people with chronic sinusitis have a yeast component. Yep. And when you put them on multiple rounds of antibiotics, it doesn't get better. Yep. And so that was the idea. And then as far as treatment, we're looking at a xylitol-based fluconazole or itraconazole, xylitol, and a little bit of mupirocin as an antimicrobial in a sinus spray, and then a probiotic for the gut. That's what it's about. What we're doing, and then an oral, and then an antimicrobial rinse for the
Yep.
month.
Yeah, because you can definitely see that, and I think even angular cheilitis has been associated in some patients, not all, with yeast overgrowth too.
Yes, yeah, we treat angular cheilitis with actually vaginal creams and oral rinse, and treat that. Is there a good test? Do you think? Is there something that a dentist could do that would? Is there a test that a dentist could do that wouldn't be too overwhelming to look for yeast?
Well, at least in the gut, you can do the Genova Labs does a simple urine test, which is a test checking for the metabolites of both bacteria and yeast. It checks arabinitol, which is a marker for Candida. Now, I'm not certain if the arabinitol is produced by all of the yeast, but it's oftentimes a pretty sensitive marker for yeast overgrowth. So that would be one way of looking at it. And then the other potential thing, if you're really concerned, is to do stool testing, and they'll check for the DNA by PCR of various yeast species.
Okay, and that would be and there's multiple companies for that as well.
Yeah, I've been using the company that I use is GI Map. They do quantitative PCR analysis. There are a lot of different companies that are out there, and they all have their niche. But from a clinical standpoint, and as a practicing clinician, I find the GI Map test to really be very, very helpful. It's very inclusive of a lot of clinically relevant organisms, and it gives you a lot of practitioners are sort of overwhelmed by it because it gives you so much information. But I'd rather have too much data than not enough data. And you typically learn on what may be a red herring or some type of a transient organism versus what's clinically significant. And that comes with just sort of doing more and more of them and looking at the clinical picture, and then in turn taking into context the results of the GI map testing.
Yeah. And then, Todd, for hydration, we're just trying to get people to drink half their body weight in ounces. Any comments about dehydration or?
Yeah, I think the biggest thing with dehydration is by the time you're thirsty, you're already dehydrated. So you want to be drinking water before you're thirsty. And then the other thing is to really be aware of dehydration in the elderly. Once people are reaching, it might be 65, 75, the thirst centers are not as sensitive, so it's a lot easier to become dehydrated. So I try to emphasize to older people to make sure that they're drinking sufficient amounts of water throughout the day, and not waiting till they're getting thirsty.
Yep. In the world of nutrition, Todd, we have kind of four concepts that we're focused around. One would be a Mediterranean style diet, eating more vegetables, a little bit of fruit, and smaller amounts of meat. And if you're going to eat meat, real clean meat.
Yep.
And then the other one would be time-restricted feeding, just limiting the hours a day that you take in nutrition.
Oh yeah, that's actually probably one of the most simplest ways to help patients with managing hunger and also managing weight. Because in essence, we did not evolve to be eating 24/7, 365 days a year with snacks in between 3 square meals.
Right.
And we have this excess exposure to all these calories and these highly processed foods, and they're filled with fat and all these compounds that sort of make us addicted to them. And the time restricted feeding on a whole foods Mediterranean style diet is really a simple way to regaining health and getting the body back into good circadian rhythm, for sure.
Yeah. And then have you been experimenting with like Proline intermittent fasting?
I have not done that. I think that's one of those plans where if somebody wants to lose weight, it's basically a very low calorie diet, and they have fairly good science behind it. The big thing with that is, I can get people to lose weight doing anything. They can go on the grapefruit diet, and they go on the Atkins diet, and they go on a Medifast diet or Weight Watchers. But the question is teaching them how to eat and what to eat, what not to eat, and when to eat is really, really more important. So it's very easy for people to lose weight. It's hard for people to keep the weight off.
Yep.
So but there is some science behind that. It's a little bit, I think, gimmicky in the sense that it's relatively expensive, and you don't get that much in terms of the food that you're getting. The calories are really quite restricted. It makes it sort of simple. It's like a no-brainer kind of a thing. It comes in a box, and you just
Right.
take what they have. There may be a niche for that, but I haven't found the need to use that.
Okay. And then how about the next thing that we do is we recommend some product in our, or not really a product, but a concept, and that's liver detoxification. This would be another area where you'd have a lot of expertise, Todd, but the veg cleanse from Designs for Health, that product. Can you give like a few sentence comments on the effectiveness of that product?
Yeah, I like a lot of the Designs for Health products. The science behind them are really quite good, and the veg cleanse helps with balancing phase 1 and phase 2 detoxification pathways, and the detoxification in the body is really an interesting concept. I mean, we're not really trained in our medical training or our dental training that much about detoxification. We sort of take it for granted because if you eat something, your body sort of eliminates it. And there's a whole variety of different ways in which the body detoxifies. I mean, we detoxify through our breathing. We get rid of CO2, which is a toxin. You don't want CO2 to build up. We detoxify through sweating. And then we have the cytochrome P450 systems, which activate and conjugate toxins in the body. And they're not just found in the liver, they're actually found throughout the body. So checking and supporting phase 1 and phase 2 detoxification is really critical towards health. In fact, some of the studies on longevity have more to do with how efficiently a person is at detoxifying. And if somebody's a good detoxifier, they have what I call the George Burns gene, where they can, smoke a cigar and have 2 martinis every day and live to 100. And those are people who probably are blessed with good detox genes. So supporting detox is especially important when a person's trying to lose weight. So let's say a person's more than 25 pounds overweight and they're trying to lose that weight. Toxins get stored in fat. So you want to be supporting detoxification during any type of significant weight loss, and then just supporting detoxification overall. Cruciferous vegetables, watercress, broccoli, Brussels sprouts, etc., are really excellent. And then onions and garlic, the allium family is also really good for detox support. And then just making sure that the urine is more alkaline. Studies have shown that a higher pH in the body facilitates the excretion of toxins. So checking urine pH can be an important aspect. And then also just making sure that you're moving your bowels every day, a minimum once a day, up to 3 times a day. You want to be doing that. So that's the other phases of detox.
Sure. And then Todd, would you say that the urine, should it be first morning urine, and should you just track it over time? Is that what
you can track it over time, and basically getting more fruits and vegetables in your diet will help you to keep the urine on a more alkaline level, which will also help to support detoxification.
Yep. Todd, the next area I wanted to talk about was exercise, and what we're trying to tell people is, some aerobics mixed with resistance exercise. What's your general kind of bottom line comment to your patients about exercise?
Well, that you bring up an excellent point. Some patients, I would say most patients that I talk to, I always encourage them to get more exercise. Although for some patients, I have them actually cut back on exercise because they can overdo exercise, or just like anything. And I actually will sometimes not even use the word exercise. I use the word play. The reason being is when you tell most people, go exercise, for a lot of people, that's like saying, go do your homework. They don't equate it with having fun. And when we were kids, we went out and played baseball and, soccer and whatever. And when our movement and our activity was fun. And a lot of people don't find exercise, especially structured exercise or exercise in the gym, fun. So I tell patients to really make their exercise as fun as possible. And I do exactly what you're talking about, and I do that myself. I think, if you're going to choose between cardiovascular exercise and weight resistance exercise, probably for anyone after the age of 50, I would say weight resistance is probably even better, because you can get the cardiovascular benefits by doing circuit training and maintaining muscle tone and muscle mass, along with the added benefits of skeletal strengthening with weight resistance, really sort of trumps that type of exercise as some of the best. So it's really a pivotal part of people's, foundation for, wanting to be well and wanting to age well. So definitely that's, part of what I have patients do. And I always, ask patients, how do you spend your day? Because a lot of us spend our days, nowadays sitting behind a desk.
Sure.
And I actually have for a few years now a standing desk, because I find that sitting for prolonged periods of time really inactivates a lot of muscle activity and a specific enzyme in muscles called lipoprotein lipase. So just moving your body on a regular basis is a form of exercise. We call that fidgeting, or just non-conscious kind of movement.
Sure.
A lot of people don't have that anymore because they're sort of chained to desks. So trying to get your body moving at some degree every hour, using a standing desk when you can, and then incorporating exercise at least 3 times a week minimum. And again, you can overdo it. Some of these patients I see, they're exercising 6-7 days a week, and they're not really giving their body's time for rest and recovery. So you've got to be, wise about how to do it. And then sometimes, for patients who are really, quite ignorant or deconditioned, I'll have them work with an exercise trainer, exercise physiologist, to really get an exercise prescription. That way they know exactly what to do. They're working on certain parts of the body. They're doing it safely, and they're doing it really for maximum effect.
Yep. We have a little circuit training thing in the library called 7-minute exercise, and you can pick full body, abs, core, whatever. You can, if you buy the app, it's, I think, $60 for the year or something, but it gives you a bunch of little 7-minute routines, and they really vary the exercise, which is important too. It's not like just running for an hour and a half. They have, it's all different. And it is, when you said circuit training, that reminded me of that, because that's really what it is, circuit training. So that's good. So I think we're pretty aligned there. Our next area that we're starting to help patients with is stress management. And one of my concerns about stress management, and what we're trying to do, is we're trying to measure it. So do you measure stress management with cortisol, with urinary markers? How do you manage? How do you measure stress?
Well, that's a good point. I mean, there's acute stress and chronic stress, and there's different gradations of that. You can, measure chronic stress with cortisol testing to look for the circadian rhythm of cortisol, and that can tell you if someone is having, high levels of cortisol either in the morning or at nighttime, or if they're more flatline, which is more of a chronic type of stress. You can also measure urinary catecholamines with organic acids. That's another way of stress. And I pretty much ask patients, how much stress do you have, and what kind of stress is it? Is it good stress? Is it bad stress? Is it stress that you have control over? And then what are you doing for the stress? And there's stress that we, have control over, and then there's stress that we don't have control over. And there's stress also that we create on ourselves. I tell patients that, life is always about having some form of stress, and stress is good. It keeps us alive. It keeps us, moving in the right direction. So having no stress in your life is really a dull life. You want to have some stress, and usually you want to have a good stress. And there's a whole variety of different techniques and tools to help people manage stress.
Yeah.
Getting back to the exercise piece, I oftentimes will ask patients, what do you do for stress? And a lot of patients will say, well, I run. And then I ask them, well, what are you running from? And not to say that running is a bad thing to do, but running is not the same as doing a relaxation practice such as yoga, meditation, deep breathing exercises, just sitting out on the grass, looking out and staring out in nature, being in nature. That's an entirely different form of invoking the relaxation response to that.
Sure.
And another really good, you talk about, a tool for measuring stress. There's an excellent tool which is made. There's a lot of different companies that make it, but HeartMath is one of the companies out there that has pioneered the measurement of heart rate variability, and that's a very good tool for measuring cardiovascular health and also a person's ability to respond and relax to an external stressor. I don't know if you use that or recommend that to any of your patients, but that's a great tool.
Yeah, we're not, I don't have a particular measuring apparatus, but we are looking at heart rate variability and some of our breathing and some of our sleep apnea patients. But heart rate variability measurables are becoming more and more popular. So I looked at the Oura ring and I looked at the different finger rings, and for me, they were too bulky. I didn't really care for them, but we are looking for ways to measure some of these things and we're basically using it for disease or identification of imbalances, not so much constant. I've gotten a little bit tired of tracking all the measurables about my health, and it's just like overusing your cell phone or social media. Sometimes it's kind of nice just to not have to look at it.
I'm of the same. We're living in this age of, I call it, data deluge. There's so much information that comes at us with emails and text messages and stuff that, faxes and phone calls and all this kind of stuff. And I totally agree with you. I think that, just applying some common sense to that and just listening to how your body is responding is really, really key. The HeartMath, I believe, makes a little thing that you can plug into your smartphone, and that you plug it up, attach it to your ear. They also have one that you can attach, I believe, to the fingers, and that's a simple way of measuring heart rate variability. And interestingly, heart rate variability is actually a better predictor for heart disease than a stress test is. So it's a great biomarker. It really is, and it's a very safe, simple thing to do. And you can get your patients to assess their heart rate variability, and it gives a good insight into the resiliency of the body. And when I try to explain that to patients, heart rate variability sounds like this sort of vague term, because you think that you're really healthy when your heart is at a steady level all the time. Well, that's really not true. Interestingly, heart rate variability is highest when a person is a newborn. So if you go into a newborn nursery, an infant's heart rate may have a resting heart rate of about 100, and then within a matter of seconds, it can rise up to 200, and then immediately and quickly drop back down to 100. So it's the ability to put the pedal to the metal and pump out a lot of blood out of the heart, and then when you can quickly recover. And that variability is a sine qua non of a healthy autonomic nervous system and autonomic heart rate.
Really interesting. I'm making a note, Todd, because at our member rally in May, we're going to ask you to talk about microbiome and some of that stuff, but it might be nice to add, there's a lot of us that are interested in the heart rate variability piece, and some of us don't understand it. So it might be nice to put together something, 15 minutes or something on that.
Oh yeah, I really enjoy talking about that, because it's a very simple thing to do. It's a simple thing to measure. And it is probably, when you look at vital signs, it's probably one of the most important vital signs that you can get in a patient. It's very, very inexpensive, and patients can do it themselves. Once you get patients to understand what it is and how it works, it's really it's a very valuable feedback tool. And patients really like it once they delve into it and learn how to control that stress response. Then that's when they really can invoke the relaxation response.